have revealed during this report from 2017 to 2021, the 5-year lung cancer survival rate has increased 26%. And we believe it's because of multiple factors. So we know that there's an increased access to lung cancer screening. More people can get the screening. Advancement in research. We think that that has really made a difference in biomarker testing, which really can help identify eligibility for individuals for targeted treatment. And I think I'd like to start with biomarker testing because I do think that that is really important. And it's something new that we're looking at in our State of Lung Cancer report this year. It's insurance coverage of comprehensive biomarker testing. And biomarker testing and its results are really important because they find certain biomarkers that can determine the treatment options that would be best for individuals with lung cancer. So we want to make sure that individuals are talking to their healthcare provider, that the healthcare provider tests the tumor for DNA and levels of specific proteins. We want to make sure that testing also shows the important protein called PD-L1, which can really help predict if a patient would also benefit from immunotherapy. And so insurance coverage for this is extremely important because it removes the cost barrier so that people with lung cancer can get the biomarker testing. But right now, coverage for biomarker testing is only required in some states. And the State of Lung Cancer report found that only 15 states require insurance coverage for comprehensive biomarker testing. 5 states require some plans to cover it, and there are 30 states in Washington, D.C. that have yet to require any type of coverage for this biomarker testing. And as I said earlier, we know that if we can determine what causes the tumor to grow, a person might be able to go on targeted therapy that can either slow that tumor growth or shrink that tumor growth. So it's really important to be able to make sure everyone has access and everyone utilizes biomarker testing. And then if we start to look at some of the highlights of the report, one of the other areas that we often look at is, people of color who are diagnosed with lung cancer face worse outcomes when compared to white individuals. And so people of color who are diagnosed with lung cancer are less likely to be diagnosed early. They're less likely to be alive 5 years after diagnosis. They are less likely to receive surgical treatment and more likely to receive no treatment. So we have so much work to do to eliminate lung cancer health disparities. One of the other areas that we look at in the report is lung cancer screening. As I mentioned earlier, lung cancer screening saves lives. There is no doubt. And so the report really tracks lung cancer screening nationally and by state. And in 2023, only 16% of individuals who were eligible to be screened were screened. Rhode Island had the best screening rate at 28.6%. Wyoming had the worst at 8.6%. And we have looked at screening multiple years, but we had to use a new data source this year. So we don't want to go back and look and have people or individuals compare data because we had to use a new data source this year. Some of the other areas that we look at new lung cancer cases. Close to 235 people will be diagnosed with lung cancer this year, with the rate of new cases varying by state. And individuals can go in and look at this report and see where their state stands. Early diagnosis, which is the number of people diagnosed with lung cancer before their tumor has spread, or the early diagnosis rate, increased 11% over the last 5 years to 27.4%. We know that, as I mentioned, surgical treatment, lung cancer can often be treated with surgery if it's diagnosed at an early stage and hasn't spread. So nationally, 20.7% of cases underwent surgery. And then lack of treatment. Nationally, more than 1 in 5 individuals receive no treatment. And so with all of the knowledge that we have about lung cancer now and all the work that's being done, we really need individuals to be able to be screened and then be able to access the type of treatment that they need. It's really important for clinicians to know what the high risk criteria is so that they can make it a point to really have discussions with patients who are eligible for the screening. Also, to do a little bit of research and know what type of coverage individuals have so that you can guide them in the right direction. The American Lung Association has all kinds of resources, not only for patients, but for healthcare providers too. We can encourage healthcare providers to have their patients join support groups. We have a lung cancer helpline. We have a navigation program. And I think one of the more important items for me is, regardless of what type of treatment an individual is prescribed by a physician, it's really important to include clinical trials in that. I think that we want to make sure individuals have access to all the clinical trials that are available. Often it's kind of a last minute thought about clinical trials, but it should be part of everyone's action plan or treatment plan. Other areas help individuals get the resources they need, for example, for smoking cessation resources. Make sure that they're trained in the lung cancer treatment guidelines. So there's a variety of ways that clinicians can help their patients by being educated on lung cancer in general, the treatments available, and then the resources that are available for their patients. I think it's really important for everyone to be able to understand that anyone can get lung cancer and no one deserves lung cancer. I think that it's really important to understand where the resources are located and what resources are located. Since 2014, there have been more than 60 new lung cancer therapies approved by the United States FDA. So we are providing life and hope to those living with disease. And I think a lot of these larger national federal related organizations really have been helping to raise the awareness, to make sure that the treatments are available, and to really get people to utilize those resources that are out there. I think if people would like to get involved, we have a couple action steps. I just want to mention is that, this year with State of Lung Cancer, we are calling for all states to implement policies to require insurance coverage of comprehensive biomarker testing. We're also calling on Congress to pass the Increasing Access to Lung Cancer Screening Act. And individuals can go to our website at lung.org and they can do and take these calls to action. I also would encourage anyone who, whether they're a patient, whether they're a caregiver, whether they have a friend with lung cancer, to go to our website at lung.org and look at the information that we have available on lung cancer. It is quite comprehensive. As I mentioned earlier, we have a navigational program through our lung helpline that individuals can use for free. So one of our staff are bilingual, one of our staff will help with any questions or concerns an individual or caregiver has, and then help them navigate through the system. We'll even sometimes, help them set up appointments, make sure transportation is available. If they don't have insurance, we'll help see if there's a way for them to be able to get some type of coverage. So I think it's really important for people just to know what resources are available to them. And I feel that the American Lung Association has a great list of resources. We also have support systems. Many people, we don't want people to feel that they're going through this alone. So many people utilize our online platform called Inspire. We have support groups. We work with a group called Immerman's Angels, where you can have a mentor that you can just call and you can talk to, when maybe you're not feeling so well or when maybe you have some questions. So all of these resources are available. And I think that the most important thing individuals can do is to educate themselves and utilize what's available to them.